Ehlers Danlos syndrome is a term used to describe a group of inherited collagen disorders. These individuals can have problems with their joints, their skin, and in some cases the vasculature. Some of the signs and symptoms of EDS include stretchy skin, skin fragility where wounds won't heal very well. They may open up after they've healed, scars that widen over time and are very thin, as well as easy bruising and easy bleeding. Other signs include a joint hypermobility, so loose joints, double jointedness, and vision problems, GI problems, as well as crowded teeth and unknown or unexplained bleeding. Many people, when they think about Ehlers Danlos syndrome, they think of the classic form of Ehlers Danlos syndrome, where these individuals have very loose joints and can actually have joint dislocations and subluxations. They also have the skin fragility. Their skin doesn't heal very well. It's very stretchy, very smooth, very soft, and has a velvety quality to it. And they can have joint pains. They can have, in some cases, even a problem with their vessels. There are other forms that are purely vascular, where these people can have the velvety skin, stretchy skin, and joint hypermobility, but they don't have to. But the main problem occurs in their vessels, and these vessels can dissect or rupture. These individuals can also have problems with other tubular structures, including the intestines and the uterus in women. And the more common one is the joint hypermobility form, where people have essentially very loose joints and no skin fragility. Their skin may be soft, it may be somewhat stretchy, but it doesn't have problems with wound healing per se. It doesn't really have problems with wound dehiscence or opening up of the wounds after they've healed. But pain in these individuals is usually the most difficult thing to manage. I'd say the diagnosis for many of the forms of Ehlers Danlos syndrome is based off the clinical exam, and from your clinical exam you will determine if subsequent genetic testing is actually needed. Well, for some of the subtypes, classic, there is some genetic testing. Vascular form, there's genetic testing. In some of the more rare forms, there is. The hypermobility form, there is one gene that's very rare that does have genetic testing, but but even if that was to be positive, that wouldn't change our management. So in many cases, I would say almost all the cases for hypermobility form, we don't do genetic testing. It depends on the subtype. Those for classic and hypermobility form tend to see physical medicine and, in some cases, pain rehabilitation. Those individuals who have vascular forms can see cardiology or vascular medicine to have frequent surveillance of their vessels to ensure that there's no dissection or aneurysms that may develop over time. Some of the other subtypes, even the classic as well as and the hypermobility form, may need orthopedic intervention if they have severe scoliosis.